All right, ready, set, go.
My name's Charlena, and I actually had the MGB for the second time last week, so this is my second time around. The first time I do not consider a failure. I just want to make that very clear to everyone that might be panicking that hasn't had it yet, that I'm having it for a second time. At my peak weight, I was probably close to 500 pounds, so this is a big, big, big difference. I had to lose a significant amount of weight to even have the surgery. I was considered a risk. I was pretty young, so to be that heavy and on an operating table, it just, I had to get down to, I guess, a decent weight to even consider the MGB. And at that time, I was over 300 pounds. I think I was 340, 360, sorry, when I had, I think, well, close to that, but when I had the first one, and I lost about 100 pounds with the first one, which was spectacular. There's no way I could have lost that and kept it off. In order to lose the weight for the first MGB that I had, I did the OptiFast program and some crazy crack diet pills that I wouldn't recommend to anyone. There's no way they're healthy. They made me shaky. They, walls were weaving in and out. You
Lindsay Lohan?
Yeah, very Lindsay Lohan. So there's no way you can maintain that through a whole lifetime. And I realized that through this huge crash course dieting to have the first one, that this was absolutely the right decision for me. There was no way I was going to be able to lose the weight and keep it off in any sort of healthy manner, except for through this surgery. And I actually did probably 4 years worth of research before having the procedure with Dr. Rutledge. I went and talked to various other surgeons, and this is the only one that really worked for me. It was the fact that it could be revised, it could be reversed, was the huge, huge thing for me. I didn't want, I was 21 the first time that I had this. That's a lot of years between 21 and the rest of your life that things can go wrong, and I might need to have it reversed if, I need to be able to absorb medications differently, or something like that happens. So that was a really, really big part for me. There was also the fact that, I could have it revised later, which, thank goodness, because I did. And also the weight loss results with Dr. Rutledge, it was so different. Seeing the other surgeries that they plummeted down to this low weight, and then it was almost like a yo-yo, just instantly back up. And that's not what I was looking for. This is a long-term life solution, so that's how I ended up with Dr.
So your first surgery was when?
4 years ago, the day before my surgery.
Oh, great. And then 4 years later, you're back, and
yeah.
How'd the surgery go?
It went great. It went great. I think I was more out of it the day after surgery than anything else. It was kind of groggy, the same. I was afraid to walk down the hallway because I thought I was going to fall asleep. Not a lot of pain. The first
sorry,
day,
what'd you say?
Not a lot of pain. It really wasn't. Considering
the next one on the internet.
Considering that you just had major surgery, you almost have to remind yourself. So that was, a big shock for me, and I remember it from the first time. I think it was easier this time for me because I was a little bit lighter. Right. So, just moving around in general is easier. But
and just to let everybody know, what we did is we went in and we looked. We saw that everything looked good from what we left behind, and we found that there was about a 6-foot bypass from that 4 years ago. And your stomach pouch, we saw some spots where we thought we could narrow it, so we grabbed the stomach and trimmed it and made it smaller, and then we bypassed an additional 8 feet. So now she's, compared to our usual patient, has a 14-foot bypass. Wow. So, as they say on some of the police shows, you're going down.
Yeah, I'm ready. But yeah, it was great. The day after surgery, I think the first day in the hotel was probably the worst, but the worst compared to what? It was just, there was no pain medicine. So, you're feeling everything, and it was a little sore. I just kind of laid low. In the hotel, I would recommend having a recliner or some sort of chair that you can sit in, because being flat, horizontal or vertical, those two options aren't really the greatest. Something in between is a nice, solution. But still, that was okay. Not a big deal. We actually ended up enjoying the second half of our trip quite a bit, because Vegas, we went and saw a show and walked around and did all that stuff, so turned it into a little bit of a vacation.
Don't.
Okay,
No. It's up to you.
Only for you.
What's that?
Only for you.
Oh. Are you uncomfortable with the weight?
Okay, then no.